As flu season approaches this fall, some local doctors' predictions for the flu are more optimistic than initially expected.
Reporter Maddie Biertemple has more on the risk of co-infection with the coronavirus and why doctors recommend getting your shot earlier.
CDC Director Robert Redfield made a bleak projection this month about flu season coinciding with coronavirus.
This could be the worst fall from a public health perspective we've ever had.
But some doctors are saying the opposite.
I think we can have one of the best flu seasons we have ever had, and South America just experienced that.
Health professionals point to the southern hemisphere as a hopeful harbinger for this fall.
We can expect that the same flu viruses that are circulating in the southern hemisphere our summer and their winter over the next few months is going to be coming up with a milder season, but there's no guarantee.
Although that may be a positive sign, doctors say individuals should still get a flu shot, practice social distancing, and wear a mask, because getting both COVID-19 and the flu could be deadly.
What we know from experience, when you are sick with two viruses at the same time, those people are sicker and have higher hospitalization, ICU, and mortality rates.
Field medical officer with the North Dakota Department of Health, Dr. Joan Connell, says she's telling her patients to get their shot early in the case that a coronavirus vaccine becomes available soon.
The vaccines that are going to be coming out cannot be administered at the same time as another vaccine. So that's another reason to get your flu shot now.
At Friday's Burley Morton COVID-19 task force meeting, Connell also encouraged mass vaccinations for influenza as practice for when a COVID-19 vaccine does arrive.
We are really encouraging those sort of creative thoughts of mass vaccination and practicing with the influenza vaccine.
Task force member Renee Mock says those plans are already in the works.
As an FYI for Bismarck, trying to do some drive-through flu clinics similar to the COVID testing that we have done.
Mateo says his hospital's employees will begin getting their flu shots starting tomorrow, and he encourages others to get theirs soon too.
You can get them at a primary care physician's office, a walk-in clinic, a pharmacy. It should be freely available. The idea is just to have the right kind of motivation to go ahead and get it done earlier this year, slightly earlier.
Reporting in Bismarck for KX News, Maddie Biertemple.
A coronavirus vaccine may not be far off. Earlier this month, the CDC selected North Dakota as part of a pilot project for distribution of a COVID-19 vaccine.
Which brings us now